Right. Today, today also we are going to discuss about the middle cerebral artery. Consider the middle cerebral artery where it is situated. We know the exact area inside the brain. There are two hemispheres. The midpoint laterally, temporal, parietal lobe give the blood circulation supply to this middle cerebral artery. It comes from the carotid artery, internal carotid artery. This is the major circulation supply of the brain. This is the brain. This is the lateral area, temporal, parietal area. This is the supply of the proximal part, distal part of the middle cerebral artery. Today we are going to discuss about the major point. This middle cerebral arterial damage or some form of vascular damage of the brain due to some form of trauma, road traffic accident, Parkinson's disease, Alzheimer's disease, some form of tumor inside the brain hemisphere. This is the dominant side of the brain hemisphere, left side. Due to left side damage, left side damage, contralaterally hemiplegia of the right side upper limb, face, trunk and lower limb. Today we are discuss the perceptual problem. There are some form of problem. Perceptual problem, cognitive problem, mainly behavioral problem, emotional problem, motor problem, sensory problem. Lot of problem are having this side. But today we are going to discuss perceptual problem due to damage of this lateral side of the dominant hemisphere. Right. We are going to discuss what is the perception. This is the person, it's the beautiful person. Due to damage of the dominant hemisphere, middle cerebral artery, it's the dominant hemisphere, middle cerebral artery damage, this area. There are a lot of perceptual problems we can tackle. Now, what is the perception? The external environmental. This is the external environmental. The person who take the some form of stimulation, some form of sensory input, some form of external identification, some form of external learning ability. Just the person take to the external, some form of externally sensory gathering to external environment. This is the perception. Going to details, this is the eye. I take to the visual perception. Nasal, visual, smell, ear, auditory stimulation. Visual, smell, auditory stimulation. This is the taste. These are the perceptual absorption unit of the body. Visual, smell, eye, nose, ear, and tongue, the taste and skin. This is the skin tactile sensation, taste sensation, auditory, smell, and visual. This is the environmental stimulation. The gathering these environmental stimulation is come to the brain and pass, ration, and all learning. These things connect to the brain. Visual cortex take to the visually some form of object, some form of function, some form of identification, some form of person face, some form of alphabet, some form of drawing ability, some form of construction, a lot of spatial relationship and auditory sound, gathering sound, the speech production, some form of taste, several tastes. We know. Auditory, nasal, some form of smell, the sweet smell, rose smell, the lot of smells are there. Tactile, the tactile can be identified, the temperature, vibration, and pain. Lot of coming to the external environmental and it's installed to the brain. Fast and recent memory, fast memory, recent memory. Likewise, it is absorbed to the brain. And inside the brain, it is refresh and it is connect the new things and is modify a lot of there inside the brain. Right, this is the perception, the small identification of the perception. Right, now we are going to the inside the brain. What are the area connect to the perception? Visual area. The visually identification is the visually connect the cranial nerve, the visual pathway. Lot of cranial nerve connect to the eye, optic nerve, oculomotor nerve, Optic nerve, oculomotor nerve, trochlear nerve, abduction nerve. Optic nerve, oculomotor nerve, trochlear nerve, abduction nerve. These nerve connect to the visually and take the information external environmental, give the optic nerve suprathalamic lateral genicular body, and it's connect to the posterior aspect of the brain. This is the visual cortex. Visual cortex. Visual cortex. Visual cortex and front of the accessory supplementary visual cortex give the supply eye. The all are visually taken, give the supply to the brain, and it's installed in this area. Past and recent connect and identification. This is the most important thing to in the perception pathway visually. Right now, then go to the smell. Olfactory now give the smell supply to the internal area. This is the internal area. Anterior side, anterior inferior area give the olfactor, the nasal supply. To the olfactor bulb, give the nasal supply to the olfactor bulb. It's installed to the inferior, anterior, inferior frontal lobe. This is the area. Smell taken to the olfactory bulb and anterior, inferior olfactory area is installed to the perceptual smell stimulation. That's the conclude the smell. The auditory supply. Auditory supply to the ear. It's connect to the temporal area, the auditory area, supplementary auditory area. Auditory area, auditory cortex, supplementary auditory cortex. It's connect the auditory supply to the inferior temporal lobe to the auditory perception ability. Let's go. This is also the go to the cranial nerve. trigeminal nerve, trochlear nerve, facial nerve, 8. Auditory nerve, auditory, vestibular and cochlear nerve. Vestibular and cochlear nerve, the cranial nerve 8, give the auditory supply to the brain auditory area. Is installed auditory perception. Now, those are the external learning. When the person is when born in the prenatal, natal, and this is small child, the gradually, externally learning. These are the we are educate some form of learning things. These small children, the teenagers, and they are adults come to the all sensory environmental external supply to the brain, and this is the brain educated this external environmental, this is the perception. Then we are going to discuss about the auditory also, the right taste also the connect. This is the tractum solitarius. The tractum solitarius take the taste and give the taste also they give the brain. 12th, 9th cranial nerve. This is the glossopharyngeal and hypoglossal. They take to the taste of the some form of sweet taste and other several tastes taken to give the brain and its install. This is the tactus solitarius, and it's installed to the brain. Right, skin. Skin is the most important because of the skin is the lot of sensory input taken. It is the spinal cord, dorsal column, fascicular gracilis, fascicular cuneatus, the tactile stimulus, a lot of go through the spinal cord, then it gives supply to the brain. That is the sensory cortex, most important the sensory cortex. This is the sensory area. Sensory cortex take to the lot of sensation. It is also some form of several part, the supplementary sensory area and major sensory area, primary sensory area, take the sensory cortex. This is the major function inside and it's installed the sensory input in the brain. Right, lot of perceptual things take to the environmental and give to the brain and it's installed to the brain. We are discuss some form of little bit thing in this session. Right now we are going to the perceptual problem identification. Right, we are going to divide this perceptual topic, some several topics. First one is the visual perceptual disorder. Visual perceptual disorder. Second one is the visual spatial perceptual disorder. Third one is the tactile perceptual disorder. The fourth one is motor perceptual disorder. Right, this is the major things we are going to discuss. Perception is divide some form of visual, a visual take to the perception, and it is a disorder. Why is happening to the disorder? The brain damage happening to the middle cerebral artery around these areas. The visual perceptual disorder having this patient. Visual spatial, around the environmental and visual connect to the perceptual disorder. Tactile, when the hand taken some form of tactile, this is the, we can tell these things. What is these things? The middle cerebral artery damage patient or around the brain damage patient, he can't tell what is this, and tactile can't identification. Motor perceptual disorder. This is the motor function, the sequence motor function. The one by one is sequence motor function. The dressing like sequence things. The making some form of car and motorcycle production. This is the making some form of building. Likewise, the construction problem. This is the motor perceptual disorder. Right, now we are going to discuss this subtype one by one. The visual perceptual disorder is the first is the agnosia. The agnosia is visually can't identify. The visually can't identify what is this. Visually can't identify external environmental. What is this? What is that? What is this picture? What is this face? Who is this friend? A lot of can't identify. They can't make out these things. This is the agnosia. When consider this agnosia, so mainly we can divide the some form of three things. So visually can't identify the some form of the auditory, internal auditory comes some form of words. Hello, how are you? Can't identify what is he tell. The auditory is agnosia. Auditory can't process these things and identify what is he tell. That's the problem. Visually can't, auditory can't, that's the tactile also the can't identify these things. This is also the subtitle. Agnosia, divide 3. Visual agnosia. Visual agnosia is the auditory agnosia. It is the tactile agnosia. Right? We are going to discuss the agnosia. Why it is agnosia happening? The some form of visual visual cortex is the posterior side of the brain. The visual cortex, posterior side of the brain. This is the visual cortex, and this is the visual supplementary cortex. And visual connect to the some form of auditory side, and visual connect in some form of sensory area. This is area damage when this patient having the visual agnosia. Oh, auditory also there. Auditory area also there. This is the auditory area. The auditory area also the affect to the middle cerebral arterial damage. This is the auditory problem also these patient having. This sensory area. This is the central sulcus. Sensory area also the damage. The tactile can't identify. This area also the hand tactile area. The posterior aspect of the central sulcus. Sensory area also the posteriorly have. The spatial relation also they have this area. Spatial relationship. And hand tactile area also this area. Posterior side. This is the superior temporal area, and this area is the parietal area, the posterior side and lateral side of the parietal area. This area damage to the visually and auditory and tactile. Lot of problems are having this patient. Right, agnosia. How we can tackle this cerebrovascular accident damage patient having agnosia? The first one, face. We ask the family members' face. This is the face. Family member's face. The patient can't identify the family member's face. And patient can't identify the girlfriend also. Patient can't identify the friends. They are friends. Friends. Patient can't identify the friends. Patient can't identify the family members. Patient can't identify the famous one, famous face. Famous face. This is the agnosia happening to this patient. This is some form of sympathy. Right. Agnosia, the visually can't identify. This is the some form of how to check this patient having the agnosia. This is the one. Second, we are going to the auditory agnosia. When we are tell to the when we are tell to the patient the voice signal, give the voice signal. What's your name? The patient is can't to tell name. There's also the connect some form of aphasia also. Aphasia also the connect these things. This is the auditory agnosia also the connect thing. He can't tell the name. That's the voicely. What is your village? He can't tell the village. It is also the memory also the connect. If you are it's no, some form of the little bit question we can ask. That patient can't to give the answer because he is always head nod. This is the his answer. Now we can understand the he can't this voice agnosia. It's a voice he can't get the question inside the brain. That is also the chronic aphasia. A different it being in between. What is the different? You must understand these things. Tactile, the tactile is also the most important. Tactile, we give some form of things. The visually also the tactile agnosia is the most important to visual close the eyes, the patient close the eyes and give the hand some form of thing, give the some form of cup, the teacup. When he take the teacup, he uh, some form of little bit touch. He can't tell what is this. This is a tactile agnosia, right? Right. There a lot of things are there. Now we are going to the second thing is the color agnosia. Color agnosia is another thing. This patient having the color agnosia. This agnosia also the he can identify the color. What is the color is this? The anomia is that he can't tell the color. What is the color? This is the red color. This is the green color. This is the white color. Agnosia is the when the wearing some form of t-shirt. That patient. What is your t-shirt color? He can't tell the color. This is color is gray likewise. This is the color agnosia. When that patient go to the some form of soap, he can't take the some form of color things. He can't identify what is color and what is this color, what is this color. He is always is traveling and some form of the brain is the is stressful situation come to his brain and personality also. There are a lot of having these things. The color agnosia is can't to the identify the color. This is the can't to the naming color. That's the most important point to the agnosia and color and anomia. The next one is the meta. Next one is the metamorphognosia. This is metamorphognosia is the patient can't understand the external environmental instrument. This is the size and shape. He can't understand the size and shape. This is the most important another thing. So when the for the example I'm going to tell when the patient having some form of size identification. For the small little bit example, when we are playing the tennis, the small tennis ball, when we are playing the football is the large ball. When that patient play in the playground, they are always try to both hand up and take the small Is small ball also the catch. The big ball also the same catch. This he can't identify the size of the ball. That's the most important thing. And size and shape identification is the this patient having this problem also. Metamorphognosia. There's a metamorphognosia. There's a metamorphognosia. Color agnosia. Color anomia and agnosia. This is a lot of things we are going to discuss. Then the next one. Next one is the personal pace. Personal